Hi, Dr. Marian Owen with Whole Family Medicine. I am putting this video together for those of you who are interested in my recent experiences with being sick with what I presume to be COVID. I still don't know whether or not I have COVID, but I have to presume based on my symptoms and the fact that that's what's going around right now, and I haven't been exposed to anybody particularly that is what I've been dealing with. So today is Tuesday, the 21st of July. I'm a little unstuck in time. And Thursday will be my 3-week mark for being sick. So 3 weeks ago Thursday, I started having headache and brain fogginess and fatigue. And this was before I was scheduled to have patients on Thursday afternoon. It was bad enough that I decided that I should cancel those patients and see what the next few days were to bring and decide how to proceed. Because of my job and because I am in the face of people a lot, I decided to go ahead and get testing. So we sent a nasal swab to LabCorp on the first day I was ill. Typically, that's a pretty good time to catch the infection. It took 10 days for me to get those results, so it didn't really help my decision making at all. Those results have come back and they were negative. I have also tested my antibodies, which I did on the 2-week mark of being sick, and as of that point my antibodies were negative. I tested them again today, but my symptoms, my clinical course, everything is completely consistent with what I read a mild or low symptomatic case of COVID is like in someone my age. So I am continuing to presume that what I had was COVID, and you have been, if you're a patient of ours, you have been alerted as to the changes we've done in the office to make it safe. I returned back to work yesterday and saw 2 people in the office, but mostly did e-visits, and I continue to do e-visits today. I do find that still to be very draining. Never have liked e-visits. I feel really distanced from you when we're doing it that way. I feel like part of my medical intuition, my ability to feel what's going on with people is gone, and so I don't like that because I learned now that I rely on that a lot. So that's been hard anyway, but I am back to being able to do that. We are still, as you know, keeping people out of the office as much as is possible. So still really emphasizing either phone or e-visits, especially now with the case rises in Georgia. It just doesn't feel safe to ask you to come in. So we're not doing that. So my clinical course has been really up and down, and that's one of the things I kind of want to put out there. I've been a little bit aware that people have that, but mine has been very dramatic, and so I want to talk about that. So the first 2 days I was sick, I was very, very sick in terms of energy. My main symptoms have been, continue to be, are crushing fatigue, brain fog. You'll see it as I talk to you now. I'm just going to pause and lose my train of thought. I can't even think of the word train of thought. It's driving me crazy. So the brain fog, I never had a cough. I did have fever equivalents, sweats and chills, but I never had an actual fever. At one point when I was feeling good and took a walk around the block, I did have my oxygen level go down, but not significantly. I think it went down to 95 and very quickly came back up as I rested. What was surprising about that, and is still very surprising to me, is how short of breath I feel with minimal activity, like climbing the stairs from the basement of my house. I will be winded after that, and that is not at all typical for me. I do aerobic exercise very regularly and typically can shoot up those stairs holding my breath and not feel short of breath, so that's a big change for me. That and the just very quick move from what feels like a pretty good brain, like I feel I can sit down and make this video right now, but when I'm done, I'm gonna kind of sit and stare into space for an hour. I know I am. It it takes it out of me to concentrate. And that is horrifying. I hate it. I hate it. That is not something I'm tolerating with grace. So along the way, I had multiple questions and multiple things that I had to decide about. My clinical course continues to be very much up and down. I'll have 2 bad days, and then I'll feel better, maybe do a few things, get a little bit of business done, maybe communicate with some patients, clear out my inbox, and then the next day I'm back down. Or maybe I walk around the block just trying to get a little bit of exercise, and the next afternoon it's gone. So my mornings tend to be pretty good. My afternoons are pretty foggy. So I'm only seeing patients in the mornings right now, and I'm not sure how I'm going to get all my charting done. That's something else I'm going to have to work on. So that's what we're doing now. I'm seeing people in the morning. I'm coming home, having lunch and taking a nap, trying to wake up and finish up some things in the afternoon. And my family is picking up a lot of the slack around here that I normally do without thinking about it, making meals, planning meals, just anything, laundry, putting things away, being generally helpful. None of that's really happening. I can sit and stare at the wall for a long time. So early on, we did make the decision to send a test. I'm not sure that at this point, with the length of time it takes to get testing back, I think if your symptoms are more clear than mine were, I'm not sure it's necessary to get a test. From public policy, public health standpoint, I think it's great if we all do. But from a you standpoint, going and sitting in your car for 4 hours, I couldn't face doing that. I didn't do it that way. We sent it from the office, and therefore it took 10 days to come back. It was useless. But I would say do it if you feel like you really just need to know. Like if there's someone you are thinking about being exposed to or have exposed that really needs to know if they've been exposed, that's when to do it. But if you can just presume that you have it and everyone you've been around has been exposed, then for your own sake, you don't need to do testing. Isolating. So I got sick on Thursday. I basically went to my bed. So I really wasn't around my family. By the end of the day, Friday, it was clear to me that I needed to act like this was COVID and not wait for a test result to come back. And at that point, already effectively we'd been isolating because I was just in bed. But at that point, we became hard and fast. I started wearing a mask if I went into the kitchen or any common areas of the house. And my family was staying out of my area. In my bedroom and this room, which is my study, are right here together. So it was really easy for them to do that. My husband just started sleeping in the guest room, and they would bring me my food and leave. And that's how we handled that for the next few days. Then the weekend after I was first sick, I actually felt good. I was thinking I might be able to get back to work, go see my dad that next weekend. And then Thursday of that week, I just crashed again. And that crash was surprising and really emotionally very hard. That felt like, okay, I got COVID, blah, 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 I'm going to be okay. That's kind of how it was in the first half. And the second half has been, didn't just get COVID. I'm going to have it for a while. I'm going to be sick. This is going to be something I'm dealing with and in a more chronic way. And because the way it's manifesting is attacking my brain, which is what I use all. That's my skill, is my brain. I don't have things I can go back on. So that's been really difficult. When it first started happening, when I got really, really worse suddenly, I called Susan to talk me off a cliff. I told my sister, who's also a physician, and I called a friend of mine who's an infectious disease doctor, and just said, look, this is what I'm experiencing. It's kind of panicking me. I actually had like a little panic feeling. It felt like I'd had like a carafe of coffee, and I had had like half of my morning cup of coffee, but I was just very, very agitated feeling. And I realize now that it was because I couldn't concentrate, but I didn't recognize that. And so that was very upsetting. And they talked me off the cliff. My infectious disease doctor friend, pulled me back from the ledge and said, look, this is what it does. Susan was great, reassuring me that this is, what we expect it to do. And I am no different from anyone else. Just because I know how things are supposed to go doesn't prevent me from having to go through them. Lessons doctors learn. So that's been the hardest part. And the other thing is just like feeling like I needed to get back to work. I'm used to being responsible. Doctors work when we're sick all the time. It's just part of the warrior mentality of being a physician, going through internship and residency. You never call out sick. You just are sick and go. And so the mental part of my sickness keeping me from being able to do that has been also really hard. Feeling like I was abandoning Susan, abandoning you all. I knew you were in good hands with her, but it was just overwhelming. So once I got kind of through that bad day and was just sick again for a few more days, I was better once I got to a place of acceptance. And now I have not had another significant worsening, though, again, at the end of any extended mental activity, I do just crash. So the decision of how to go back to work, what to do at work, what's safe to do, what's not safe to do, all of those things are things I'm navigating, and I'm definitely doing more just conferencing with Susan about decisions I'm making and making sure that I'm not thinking I'm doing something right that I'm not doing right. And that is, it's just an interesting challenge. All of this is an interesting challenge. I'm very grateful that I have her to bounce things off of. And then I just want to tell you what I have done for myself, in terms of nutritional supplementation and, body support for my immune system. While none of these things that I've been doing have double-blind, placebo-controlled studies to tell me that they're absolutely fine, nothing I'm doing is dangerous. And so I feel really safe letting you know what I decided to do. So the first few days I was sick, I was just taking a lot of oral ascorbic acid, which is vitamin C, with bioflavonoids. I think the bioflavonoids are, at least in some early reports, and just in terms of how we know how they impact the immune system, I think they are as important as the C, if not in some cases more so. So I was taking high doses of that, as much as my gut would tolerate. Too much vitamin C, things get a little loose. But because one of my big symptoms with COVID was just my gut was stopped. That food I would eat and I would stay full forever. I just felt like nothing was moving through my system. And so the vitamin C was actually fairly welcome for that. When I had that second kind of worsening and felt worse than I had at the beginning, my sister reminded me that what's going on there is at the blood vessel lining. What we believe is happening is that the inflammation is causing those blood vessels to be a little bit leaky, to let inflammatory mediators through to the brain. And so since the brain is mostly fat, it made sense to us to add a lot of fat-soluble antioxidants. So for a few days, and a few days only, I took high doses of vitamin A, not beta-carotene, but actual vitamin A. That is a fat-soluble antioxidant that's very important and has some data for antiviral effect. Although by the second worsening, I didn't think I probably still had like virus happening. I think it was my immune system's response to the virus that I was bothered by. So anyway, I added vitamin A, I added tocotrienols, which is a particular form of vitamin E that's a very effective fat-soluble antioxidant in other areas. And I just happen to have it because I take it to prevent dementia as a general rule. And so I have it around, so I was taking that. Astaxanthin is another good antioxidant that I started taking, and those helped. I believe when I did that, I would feel better. So I'm taking those in the morning before I go into clinic. I'm taking them again when I get home and have lunch, trying to decrease the inflammation that I feel. Late in the course, I also added high-dose melatonin at night. I wish that I'd thought to do that earlier. I knew it, but I didn't remember it. But a friend of mine reminded me that high-dose melatonin actually works in an immune system pathway that's very activated by COVID. So I did start doing that. The very small study that was done that did show that it seemed to be helpful was 20 milligrams at night and 10 milligrams in the morning. I didn't take that much because I don't think I'd ever wake up. Melatonin affects me pretty strongly, so I just was taking 10 milligrams at night. But in the study, the doses were much higher than that. So those are the things that I did. Also, the antiviral combinations that I've talked to you about before, specifically here. What is that one? Brain fog. Viracid. I was taking Viracid. And there are a few that I showed you early on in a COVID video. You can go back and look at that. And I don't know which ones you can even get right now because Lord knows. So now I am pacing myself. I am trying to be patient with myself, which is really hard. I frustrate easily. And I am trying, well, we are definitely limiting how many people I'm seeing, and we're doing that as much e-visits as possible, and trying to limit the amount of work I have to do outside of clinic. But Susan is there. We are doing everything we can to meet your needs in as timely a manner as we can. I appreciate all of your well wishes and supportive messages. That means a lot to me. And also just the patience that you guys are showing me and my staff. They are doing an amazing job in a really hard situation. So stick with us. We're getting through it. I am feeling encouraged that I've been back to work for 2 mornings and I've taken a nap and woken up in the afternoon and felt pretty normal. Like this is after that. I'm taping this after waking up from my nap after a Tuesday clinic. And so I feel like I'm on the upswing. I am not allowing myself to fully believe that because last time I had a relapse, it was emotionally hard, and I just want to be prepared that may happen, and that'll be okay, and we'll all just get through it. But this is not something any of you want. So do please continue to stay at home, isolate, wear your masks, only be around people in masks. Try to avoid this at all costs. Right now, our hospitals are full, our ICUs are filling up, our ventilators are on short supply, so you don't want to be someone who needs that right now. So be safe with yourself. I feel very fortunate that I had such a mild case. I don't know what I would have done if I'd gotten really, really sick because I'm not a good patient. So I hope none of you get really, really sick. So I hope that this informs those of you who wanted to be informed. I know that I'm not clear or linear in a way that I am used to being. And so for those of you, this has been a chore. Thanks for sticking it out. Let me know if you have any questions. And again, if you need anything from Whole Family Medicine, you know how to reach us. Please reach out. Know that we are doing everything we can to take care of you and your families in as timely a manner as possible, and really do appreciate your forbearance during this. So be well.